Hi, everybody. Thanks for tuning in. It's a little bit of a last minute decision to go live. We have a special guest lined up, but first and foremost, I will bring up my co-host, the awesome and incredible Jason Bainbridge. How are you doing, Jason?
Good morning, good evening, good day, good everyone. I'm good. Yep, as you can see, I'm in a different room. I'm in a different room today. So yes, it's the white background today.
It's very exciting. I'm kidding. Are you still in Vietnam, or did you move to Cambodia now?
That's next month.
Okay.
This is my work room, and to move it all over there into the next room, into the studio, and then to bring it all back again. So today it's just a random video. So I've decided just to do it in the room where the air conditioner is.
Nice. Well, thanks everybody who's tuned in. We have a special guest, Finlay Smith from New Zealand. Finlay, are you good to go? I see you backstage. I'll bring you up now. Kia ora.
Hello, how are you? I hope you can hear me better than I can hear you. You can? Oh, that's great. I can't really hear you much at all. We're outside the Ellerslie Fire Station in Auckland. It's an interesting thing. We're here for the hashtag NZ Health Crisis. If you can see that, the hashtag NZ Health Crisis, and it's got to do with the firefighters, it's got to do with the nurses, the doctors, the ambulance crews, the medics, right throughout our nation and of New Zealand. Labor back in 2020 decided to crash the public health system, and without the mandate from the people. You know, if it's one thing that we learned from our government's manipulation and the way that it's treated its people, is that mandates are obviously important. And why didn't the government have a mandate when crashing the public health system? Here in New Zealand, the government took on itself, the 60 politicians of Labor, Greens and the Maori Party took on crashing the public health system. And they have really been squeezing the patients out into the public. They've been squeezing them out of the public and into the public and getting them out of those hospitals. Lives are being lost on a daily number. Lives are being lost. This is a hashtag NZ Health Crisis. It's right throughout New Zealand on a daily basis. Patients in our community are dying, and it's a horrendous situation. What else can I tell you? There was 2020 at our last elections. We had the elections in 2020, and 6 months before those elections, Labor had decided to crash the public health system without the people's mandates, without any mandates. And they decided to do it, but forgot to tell the voters. The voters were not in on this. They went to the polls not knowing that Labor's intentions, Labor's Greens and the Maori Party here, the intention was to crash the public health system. And that policy is killing people by the day in New Zealand because the staff aren't there. So we're back at the 2020 elections. And what happened in the 2020 elections? Labor got a majority. They've been doing their polling. They decided not to tell the public of New Zealand that they are crashing the public health system. They get the majority. Now, the interesting thing is here where the mandates come in. They come in early 21 after Labor wins that majority, and they fire 20,000 nurses. 20,000 nurses out of our public hospitals. These mandates existed to the public health system, not to the private hospitals. Many private organisations never chose to take the mandates. And 20,000 nurses, it wasn't just nurses that were fired. It was surgeons, it was doctors, it was scientists. I'm in touch with all of those type of people. They were fired out of the health system. And obviously, they're not there to save lives in our community. They're not there to save lives in our community. And so when the sick go to the hospital, the patients, the staff aren't there to save their lives. And of course, we're being ended up with extra deaths on this. The question is really, why would Labor be wanting to crash the public health system? I mean, for a start, should they have told their voters they were crashing the public health system back in 2020? They should have, shouldn't they? And then the other thing is, you know, why would they do it? It's not in the public's best interest to have lives lost unnecessarily in the public health system. I mean, here in New Zealand, it must be like it is in Canada, with everybody paying towards their taxes for the public health system. Here in New Zealand, we pay $2,000 a year, every man, woman and child. And because the staff aren't there, the services can't be provided. And the first people to pay that price are the patients, the old people not getting the service. So the government is taking the taxes for the public health system, $2,000 every man, woman and child, and they're not providing the service. They're not providing the service. I'm getting some thumbs up here. We're not even talking in public. We're going to be doing a protest here very shortly at the Ellerslie fire station for the New Zealand health crisis. We were just waiting for your call to come and talk to you wonderful people that care about our planet, care about people, care about New Zealanders and Canadians, and want to sort this mess out. And, you know, the interesting thing here is, why am I standing outside a fire station? Why? What's the firefighters got to do with this situation? Well, I'll tell you what it's got to do with them. It's as the government has pushed these sick people out of the hospital, sick and dying. They're going to the A&E, sick. They've got heart attack conditions, strokes. They've got needing operations. A lady there in Wellington had a dead fetus of a baby inside her body for 2 days because the staff weren't there. She was sent home from Wellington Hospital with a dead fetus inside her body, her beautiful baby inside her body, because the staff weren't there. And these sick people get put in our community instead of in the hospitals where they belong, to save their lives and to solve these problems. Whether it's a broken leg or somebody with diabetes needing their toe amputated, the operations can't be done. A friend of mine, he lost his life waiting for an operation. The staff aren't there, and when the staff aren't there, it doesn't matter what race, colour, creed or size you are, you can't do the operations. Patients in New Zealand are dying from this health crisis, and as you push the sick people out into the community, because the hospital staff know the staff aren't there, well, you end up with sick and very critically sick people in our community. And where's that load being loaded onto? Well, the sick patients in the community are being returned back to hospital via the ambulances. The ambulances is putting pressure on the emergency department here in New Zealand, and the staff can't handle it because the patients aren't getting sorted out because the staff aren't there. And so it's just a roundabout until patients are ending up dying in their homes. And who turns up? The firefighters. In New Zealand, we've got firefighters. I can tell you 85% of those firefighters aren't paid. None of them are paid. 85%, that's 13,000 workers across our nation, 13,000 volunteers. They're going to these medical emergencies with no training, many of them no training, to save sick and dying people with no medical training because the staff were fired in our public health system. Now, the doctors and surgeons here are going on strike. The nurses have already striked across the country. They've been trying to get their message out. The government response, we don't want to talk. We're not interested in talking about problems. They only want to talk about money. And as the protests go on with these organisations and the staff and them trying to save lives on the ground daily, because people are dying daily, the government refuses to talk here. The Labor, the Greens and the Maori Party refuse to talk about the problem. They only want to talk about money. The firefighters, they were in negotiations for 18 months. 18 months of negotiations. The government refuses to talk about problems. Now, the interesting thing is, why would the government want to not talk about problems? Because they don't want to solve the problem. They're trying to crash the public health system. The question is, why are they trying to crash the public health system? So right across the medical field, from the firefighters to the nurses to the doctors. We've got staff committing suicide. We've got staff committing suicide. We've got excess patient death occurring in our community because of this calamity that Labor, the Greens and the Maori Party have stood by and watched and continue to watch on a daily basis, refusing to talk about the problems. They only want to talk about, they don't see a problem here. That's the thing, they don't see a problem here because they're crashing the public health system. They're wanting people to die in our communities. And of course, it's creating a lot of crisis across the country with excess deaths. We've got death of staff, doctors, nurses committing suicide. We've got ambulance crews committing suicide and all of that type of business. So it's good, not good. It's not good. Don't get me wrong. There's nothing good about this. And it's no way to run a country and look after the 5 million people here. It's disgraceful management by Labor, the Greens and the Maori Party in New Zealand. And New Zealanders deserve more because they're paying their taxes. And if you're not going to get the service, why should you be paying your $2,000 a year for the health system if they're not going to provide the service? Got a wonderful family going by here, a wee baby and mother going by. That's beautiful. And so the other interesting fact about this situation that is of interest is this was a complete surprise bag out of the bag of lucky dip at the elections. When you voted for Labor, you voted for people dying in your community. When you voted for Labor, they already had a policy of crashing the public health system and standing by watching lives being lost.
Yep.
You didn't know it. We didn't know it because they never told the people. But they're crashing the public health system. Now, the question is, overall, what is in Labor's next surprise bag? You know, you go, take your time to go and vote. Shouldn't you know what you're voting for? Hi, family. Lovely to see you there. Hope you had a great day, kids. And that's what it's about. We are at an intersection where there's a school next door around the corner. So it's lovely to see the kids, isn't it? Because this is the opportunity now to make a better New Zealand. We need a public health system. And we have had one since 1938, which provides health care for all New Zealanders, no matter how rich or poor, whatever colour or race you are. There's people dying in all of those. And this is well worth standing up for. It's the hashtag NZ Health Crisis. This fire isn't going out. This fire is just starting. This is a smouldering fire ready to burst into flames. How are you, family? Lovely to see you there. And so it's been a welcome pleasure to be able to speak to the public throughout New Zealand in these protests, getting those messages out. This morning, we were at Lincoln Road for about 3 hours from 8 o'clock until 11. And it was wonderful there. Wonderful support. New Zealand, go New Zealand. The New Zealand team. We need everybody on board. We need people in goal defence. We need people in midfield. We need people in attack. And that's what we're looking for. That's what we need. And this attack is not going away. It's only going to get bigger. And it's going to get bigger as the doctors and surgeons walk off the job while turn around. That's right. Thanks for the advice there. And it needs to be solved. This is a problem that needs to be solved. It's not going away. For the sake of humanity, for the sake of humans, for the sake of New Zealanders, for the well-being of our country, it's critical, and it's not going to go away. This problem is not going to go away. Labor, the Greens and the Maori Party think they can buy you off, but they can buy the doctors and nurses off. Now, the interesting thing is if Labor, Greens and the Maori Party get in again, how are you? Lovely to see you. Good, good. Have a great day. Yeah. Oh, I love your dress suit. It's awesome. Oh, that fella. He had a great dress sense. I'll show you there. Did you see that fella going across the road? Anyway, there's wonderful people around, isn't there? And so, what is Labor's next move? What is Labor's next mystery bag? If you vote Labor in, at the last time we got the mystery bag of crashing the public health system, that policy has led to deaths and suicides. Literally deaths by the day. We have numbers. There are people dying every day because of this crippling policy. Now, the question is, what is in Labor's next bag? Well, it's pretty obviously they're not going to tell us. They are not going to tell us what's in the mystery bag. But I can give you some guideline. from the research that I've done. The research I've done is the people in the health system, and many of them at the top levels are asset strippers. Their abilities and skills of the directors of the health system, their skills appear to be asset stripping. They have come from organisations where that's where they've been doing, and we've got serious trouble here. Trillions of dollars worth of hospital assets. Hi, family, lovely to see you. I'm going to be doing a live protest here soon. Take care. We've got to get this message out. I'm getting loads of support here just talking. It's awesome because there's wonderful New Zealanders. And this Team New Zealand, we want to see a better place for all New Zealanders, lives saved in our community, and more support. Thank you, family. Thank you, team. And we need a team to do it. And that's why we're here going through New Zealand, getting that message out. So if there's anybody here that can help get this message out, the doctors and surgeons are going on strike to save lives. I believe that in the next mystery bag that Labor will not disclose to you, Labor, the Greens and Maori Party, they are going to strip the assets. And there's trillions of dollars worth of national assets in there paid by many generations of New Zealanders through their taxes. Many, many generations. Jason, you're part of that. Your families are part of that. And we don't want to see that happen. No asset stripping here. This is New Zealand. We've got courage like the Canadians, and we're not going to stand by and watch this happen. Not on our watch. This is our watch. And is there any other information I can give you? Yes. I'm sorry to go on, but I can't hear you too well there. But the thing is, oh, thank you for the thumbs up. I love that. Love that smile, Jason. It's awesome. And you guys are just great in the work that you're doing, the persistence and courage and continuing on like that. It's just awesome. I'm sorry.
I was going to say
what's that?
I was going to say the only stripping we need is Labor's ass stripping.
Labor's ass stripping. Absolutely. Bring it to the table. That is a good point. That's a very good point. Now, look, there's another issue about this crashing of the public health system and asset stripping of the assets of the public interest throughout the country by asset stripping property that belongs to the taxpayers of New Zealand, the 5 million team, not the 60 team in Labor, not the 60 team in the Labor, Greens and Maori Party, is that of co-governance and its effect in this NZ health crisis. Now, how it's played out in the co-governance in the health system is they've put an entity in place that is co-governance. Now, there's a problem with that because if you, it's been crippling the organisation ability. What has happened is people have been employed based on sex, race and sexual preference. That's right, sex, sexual preference and race. Not qualifications. Qualifications are out. Sex, sexual preference and race are in. Now, I ask you to do with me the knife test. Will you do the knife test with me? Now, the knife test is you're at the operating theatre and the surgeons come up to you and they say, which surgeon would you like? Would you like the one of particular race? Would you like the one of particular sex? Would you like the one of particular sexual preference? Or would you like the one with the qualifications? And I would hope that you would choose the one with the qualifications, because that is the problem with co-governance. Not getting the right people on the job, but choosing people based on race and sex and sexual preference, and it's not going down well with the public. They are Team New Zealand. We are on the ground getting the message out, and there's tons and tons of support for it. The Kiwis are a good team. We've built good teams. We've built the All Blacks. You know, we're as good as the Canadians. Thanks for the love. And it's all about that. So together we're needed to work together to save lives in our community. New Zealanders of all sex, sexual preference and race are dying here on the ground because of government, Labor, Greens and the Maori Party crippling the New Zealand health system, pushing the sickest out of the hospitals to empty the buildings, probably to asset strip. It looks like an asset strip job. Where that money will go, the $1 trillion of built up wealth in this nation, where those trillions of dollars will go, I don't know. Where their intention is to go, I don't know where that money's going. But if we let this asset stripping happen, you know, we've got to stop it. The nurses have tried, the firefighters have tried, and the only way we know we can do it is together. So we need to work together if you want to save lives in New Zealand and the New Zealand health system. A better way together, all of us, not divided, not division. Division, no way. Us without a public health system is driving us into a third world position, and that's not what we want. So that's why I'm here at the Ellerslie Fire Station, and so I hope that's a good update there.
That was an awesome update. Absolutely awesome update. I think we just found our new Prime Minister right here.
Right?
When are you running, Finlay? Seriously, when are you running? That's the kind of passion we need. When are you running for Prime Minister, mate? That's the kind of passion we need.
Yeah. But you know, like any of us, we'll do whatever it takes, won't we? We'll do whatever it takes. We're there with the firefighters. You know, we've got the same problem in the Reserve Bank, and the Reserve Bank, the government, through co-governance running of our Reserve Bank here, they lost $10 billion, and the government jokes about it, refuses to talk about it. So, you know, it's awesome being here and being in your company and getting that message out, and, you know, together we can do something, can't we?
Yep. Agreed. Yep. Absolutely. 100%.
Are you there?
I'm here, Finlay. We can't see you anymore.
I can hear you better. I can hear you better now.
He's trying to hear us. He's trying to hear us. Yeah, do something about it. Get out there on September 16 and 19, and then again on the 28th, and roll down to Wellington. 2 weeks in a row.
So how many people are you expecting? When does the protest start, Finlay?
Well, really, I'm just doing protest talks wherever I find myself. It's going to be right through the nation, and the thing is that we want to encourage people talking about the situation and getting together so people are knowledgeable about the situation. You know, the more discussions we can have about the situation, the better. And then just arranging pop-ups of situations where we can talk openly about the situation, because there isn't one source of truth. There's 5 million here on the ground. The problems are on the ground. The politicians are up there, but
oh no. I wonder if you press the back button. Classic stream.
I tell you what, whoa! I wasn't expecting that nuclear bomb to go off. That was amazing. What an epic rant! 20 minutes non-stop. Fantastic. And he knew exactly what he's talking. He knows exactly what he's talking about as well. I wasn't joking. The guy has to run for Prime Minister. Seriously, the guy has to run.
Yeah, he's a good guy. It's nice to have him back on the show again.
Man, I tell you, that was wild. That was wild. I wonder if he's gone.
He'll find the link again. He'll be back.
He'll find the link again. But man, oh man, oh man, yeah. I mean, yeah, I'd love to see the ass stripping of that Labour and National government and ACT and the Māori Party and the Greens. All of them, they got to go. They absolutely got to go. This year's actual election is going to be wild. I tell you. I think it's still sort of like a runner-up. You know, not really a runner-up. It's kind of like the start of something different. The election may.
When is the next election in New Zealand? That's coming up soon, isn't it? Is it this year or next year?
It's coming up. It's coming up somewhere in October. I haven't looked at it, but on the 28th, Freedom New Zealand Party, they're holding a big march down to Wellington for a day, and I hear rumors that between the 16th and the 19th, that Canada is going to be launching a brand new convoy. Canada, and I hear that America's getting involved, and I also hear that Australia's getting involved. And so it looks like we might be seeing
that on the down low, Jason.
Oh, are we? Well, it's all over Facebook.
Yep.
It's all over Facebook, so it can't be that down low.
Some platforms where we're not discussing that, but yeah, I've heard that alleged.
That's why I always say that. That's exactly why I always say Why would you plan it on Facebook if you don't want anyone to know about it?
Right? Yeah, allegedly, I've heard that rumor too. No, it's all good. But
Yeah,
I hope
well,
he comes back. If not, then you know, we were going to keep it short and sweet. You have to get going to your classes soon.
I got to get to the go. Yep, I got to get to the get, because that's where it's at. So I think we'll wrap it up. But I think he's just got disconnected permanently,
Half an
and
hour.
it is time.
Finlay Smith got his point across. So what was that
Yep.
hashtag? New NZ health crisis.
Yeah, NZ New Zealand health crisis, NZ New Zealand fire crisis. Hashtag New Zealand fire crisis. Hashtag New Zealand health crisis.
Is it the words New Zealand or just NZ?
NZ. Hashtag NZ health crisis. NZ hashtag fire crisis. So yeah,
All
don't
right.
forget get in behind this year's pretty interesting. Pretty interesting. Yeah, hashtag New Zealand health crisis, and also I'll type in the other one and NZ.
Yeah, you're probably faster at it.
NZ fire crisis. This is the other one. When I first met Finlay, he was starting on the fire crisis, and then after that, he got into the nursing and medicine crisis. Although I think he was actually essential to getting things done and raising awareness, and so I think they actually started to take a serious look at what was going on with the fire crisis in New Zealand.
That's
So
funny.
yeah,
Sorry, guys.
big hand in that. And
Oh,
you
I
can hear
think
that
he
he's
might
got
be
a
back.
big voice and he's got a big message. And yeah, he waved the flags and tooted the horn and bellowed about the fire crisis, and things started to get done and started making headlines. So let's pray and give it up to Finlay for pushing it out
Absolutely.
for the health crisis, because it's like ridiculous what's going on.
Yeah,
Seriously.
if you find him on
I mean,
Facebook too,
I can't
he
imagine
goes
what's going
live
on.
a lot.
You're
so.
muted, dear. You're muted.
Oh,
Yes, you are muted. I am a one-man band at the moment. And by the way, I am the fake Rosie. I'm the fake Rosie, and sometimes I do post as Rosie because I'm here on the team. So if you see me say, "Hi, I'm fake Judy or fake Rosie," that's me. Okay.
so
Rosie,
you can't hear me right now? I'm not muted.
you maybe just want to pop out and pop back in again.
Yeah.
Yep, pop out and pop back in. I'll manage the show. I'm not as interesting as Finlay, that's for sure, because we just don't have these issues here in Asia. The only place this is really happening is probably in China. It's like amazing what's going on over there. Massive what's happening in China right now. It could even be a major revolution starting in China, and it looks like the seeds have already been planted for one in China. And major things, major changes
Is it working now?
over there. And Rosie's voice is still gone. She has lost her gone. She's
Okay.
lost her voice. Yeah, but yeah, I tell you what though, I do have to roll. So shall we hit the little button there?
Yep.
And I'll do the outro. Thank you very much for joining the show today. And don't forget to like and subscribe and hit the bell button. Because that's the only way to get heard around here and get the algorithm working. And I'm Jason Bainbridge, not your host, on behalf of Rosie Cowboy. And I'm gonna hit this little song button here, and we're gonna get out of town. So thanks for joining, and we'll see you